It's 12 o'clock officially. Oh, 12:01 now. So we are going to get started. So I'd like to thank everyone for coming on the call today. My name is Josh Walker, and we have Christina Wiesman. We run and lead the American Fork Chamber of Commerce and the Lone Peak Business Alliance. And so we started this webinar series back in March when things first started to get crazy. And we have been having experts come in and talk about the different topics that are very pertinent to what's happening, especially in the business world, and how to handle those topics. So we know that a lot of businesses have been very stressed with how to manage their employees or what to tell their employees, how to manage the health mandates that come out from the governor and from the coronavirus task force. Now we're moving into phase 2, going from red phase to orange phase. And so we're trying to navigate, what does that mean for businesses? So I don't know, Christina, do you want to talk about a little bit about some of the things we're working on?
Yeah, so this week, I've spent the better part of this week working on some information, some documentation, and some, kind of creating a toolkit for businesses in the different industries, how to move into the next phase. So things that you need to be aware of. We obviously aren't going back to normal, but we're taking a step in that direction. But there are still some things that we need to do to make sure that we keep the virus from spreading. So it's just kind of a list of recommendations, protocols for businesses. As you reopen and as you're welcoming people back into your business and as you're providing service for them again, things that you need to do to take extra precautions. And, really businesses are going to need to work to kind of build up that consumer confidence again, because people are scared. And I guess you have people on every end of the spectrum, but, people are kind of, scared to go back out into crowds like we were just talking about. They're a little bit nervous about that. I know even sometimes when I go to the grocery store and someone gets too close to me, I kind of think, I don't know if they have the coronavirus. Maybe I have the coronavirus. I don't know. Maybe I've already had COVID-19. But it's just, things have changed, and we've all kind of settled into this place that we're at now, but now we get to push ourselves out of that and move into a new place. And that can be really stressful and something that we've never done before. So we're hoping to have some information for people to kind of help you navigate that process and have a little bit of a guidelines. Just, it's really to help you create your own set of plans and your own guidelines for your particular business. Obviously, things like Cindy's Hotel are going to operate differently than, a retail store or someone who cuts hair or someone who provides childcare. So it's just kind of a starting place for you to create your own set of guidelines for that. So that should be ready today. We're going to finish working on that this afternoon. I think I've got it just about ready to turn into a document, and then we're going to turn it into some social media graphics and things like that so people can get the information quickly. So look for that hopefully tomorrow.
Awesome. Well, we don't want to waste too much time, so we're going to get right into it. I'm going to introduce Morissa Henn. She works at the intersection of public health and healthcare delivery to help families and communities flourish. I'm just reading her bio. At Intermountain, her leadership role and team are currently focused on improving mental well-being across the 24 hospital, 180 clinic integrated health system and Mountain West communities it serves. So Morissa began her career in New York City, which is a hotbed right now for COVID, focusing on the special challenges children face as a result of poverty, lack of access to healthcare, and catastrophic events. So her roles included serving as chief of staff at the nonprofit Children's Health Fund, a consultant at Manatt, hopefully I said that right, Health Solutions, and an advisor in the New York City Mayor's office. So she has a doctorate in public health from Harvard University, and a master's in public health from Columbia University. So I think one of the side effects to being holed up in my office for a million years is I forgot how to talk.
I know the feeling.
All right, so Morissa, just let me know when you want me to pull up that slideshow, and we'll go from there.
Thanks. Go right ahead, Josh. And thank you all so much for having me. It's really a privilege to speak with you, and I'm just so impressed and heartened by the care that you're taking to think about some of these bigger questions of how to support your organizations and teams at a time of significant stress for all of you, not only the organizations where you work. And so I was thinking I would take probably about 20 minutes to provide some thoughts, and then really want to open it up for discussion and questions. And happy to provide, I sent the slides over to Josh, partly so he could help me go through the slideshow, and partly so that if you want to share any of this with your organizations or even with other groups that you're a part of, maybe faith communities or community groups where you volunteer, please feel free to share the information. So we can go on to the next slide. So basically, in terms of what I hope to talk to you about today is really, what does COVID-19 mean for mental and emotional health of all of us and of the organizations and teams that we're a part of? What are some key resources and tips for this difficult time? And then what are some key considerations as all of us prepare to return to some kind of new normal? You can go on to the next one. So probably no surprise to any of you, but COVID-19 is certainly presenting some unprecedented physical and social and economic stresses for all of us in ways that could really increase emotional suffering for many people, whether or not they're already managing a mental health condition. I actually just saw some poll results from a couple days ago that half of adults in the United States report that their mental health has been negatively impacted due to worry and stress over the virus. And unfortunately, for those of us who work in healthcare and in mental health in particular, we know that as this pandemic moves on and as we kind of move maybe from response into recovery, it turns out that the mental health issues will likely continue for quite some time, particularly because the things we're doing that are important to slow the spread of the virus, such as social distancing and business and school closures, are also things that can contribute to a sense of isolation and financial distress for people. So the very things we're doing that are so important to help stop COVID also have some really unprecedented ramifications for how we emotionally and psychologically cope with this difficult time. We can go on to the next one. And so this quote from a researcher I've worked with, Dr. Vikram Patel, I thought really captured it and spoke to me personally, and maybe you as well. Our minds rely on certainty and predictability of future events to be able to plan how to spend one's time. And clearly, this is exactly what has been turned upside down. I know I'm feeling this personally and professionally, that kind of certainty and the sense of control are what feels right now very elusive. And it turns out that uncertainty and lack of control are major drivers of stress. They're probably the reason why many of us have been having trouble sleeping the last few weeks, or have found ourselves a little more snappy with our family members. Your body is actually experiencing an intense stress response right now, whether you realize it or not. And for some people, and especially people who work for us, that can contribute to increased anxiety and depression. And so that's the concern that we have. All of us are pretty resilient. We can kind of handle the short-term stress, or maybe a little less sleep for a few weeks. But what does it mean for people who are already really more vulnerable in a sense? So we can go on to the next one. And I promise we'll move from the bad news to the positive stuff soon. But, you know, it's worth noting that the situation prior to COVID was not easy either from a mental health perspective. We know that about 1 in 4 Utahns is experiencing poor mental health, which is described as having 7 or more days out of a month that they really are struggling. And we know that mental health and substance use, including opioids, are top concerns for our community. And so, you know, it's not like we're starting necessarily from the easiest point either. We can go on to the next one. You know, in addition to the 1 in 4 of us who are living with mental illness, there's 1 in 4 of us is living with someone who has mental illness, maybe a family member, child, spouse. And the challenge here is that, you know, it's not easy to get connected to services. If anyone's ever tried doing that for yourself or someone else, you know just how hard it can be. You can go on to the next one. So I think bearing mention here is the fact that here in Utah, while a lot of important efforts are underway, accessing and affording mental health and substance use treatment is extremely difficult. I've had people describe it to me as feeling like a labyrinth. It's very, very hard to navigate, what could be a harder time in your life to navigate it than when you're dealing with your own psychological and emotional stresses or that of someone in your family or community. So on to the next slide. I think what is on my mind as I think about the research that I've been involved with and past disasters is what's potentially coming, and how do we get ahead of that? Obviously, when we think about this, what we call the first wave of increased mortality and morbidity of COVID-19, that's kind of what's on the news for the most part. But there's also these other waves that we want to pay close attention to. There's the kind of that second wave of non-COVID conditions. I've certainly talked to some family members who are waiting to get treatment, waiting to get a hip replacement. I mean, these are major health concerns, but that are being really delayed due to social distancing and the stresses our health system's under. There's that third wave of people dealing with chronic conditions already. And then there's the fourth wave that I'm most focused on, which is really what does this look like from a long-term mental health and perspective of kind of trauma and burnout. All right, so on to the next slide. So luckily, I'm not going to just depress you with these struggles and these challenges, because truthfully, I feel incredible optimism and hope, because I think that this is actually a moment when we can come together as a state, as communities, as businesses in completely new ways, recognizing our ability to provide connection and support and resources in a way, kind of breaking down that stigma to say, look, we're all affected by this. Let's support one another in ways we've never previously thought of. And I'll give you a really kind of perhaps surprising example, and then get into some of the resources that I want to leave you with today. So on the next slide, last week, I had the pleasure of doing a Facebook Live with Clark Aposhian, who's the chairman of the Utah Shooting Sports Council. He's the leading gun advocate for the state. Obviously, firearms are a big part of heritage and culture here in Utah. And the reason Clark and I have been communicating a lot lately is because even though we bring sort of different perspectives from healthcare and gun rights, it turns out that we're actually both really concerned about the psychological stresses people are under, and the fact that we don't want to see that contribute to an increase in Utah's suicide rate, since firearms are the leading method of suicide, and close to 90% of gun deaths in Utah are suicides. So last week we got on Facebook and we talked about what are some important components of gun safety. How do we make sure people who need safes and locks can get access to them? So in no way was it framed as an anti-gun message whatsoever. It was simply framed as, we have this common ground goal of keeping people safe, especially at this vulnerable time. So how do we as Intermountain and the Utah Shooting Sports Council find ways to collaborate? So there's an example, I think, of one of the unusual ways in which we're coming together across different backgrounds, across different ideologies, to say, we all want our loved ones to be safe right now. We all want to be secure. How do we collaborate in wholly new ways? Another element on the next slide has been something that I've been really privileged to lead, which has been standing up Intermountain's emotional health relief hotline. And I'm so grateful that you all have been helping spread the word about this resource. This is a free call-in resource for anyone in the state of Utah. You don't have to be an Intermountain patient. You don't have to be a healthcare provider. This is for anyone who is experiencing some of the stresses of this time and wants some support. It's available 7 days a week, 10 a.m. to 10 p.m. You can see the phone number there. And we offer interpretation services for 20 languages. And every day we hear from people who are non-English speakers who really need support, and we're glad to provide that. On the next slide, you'll see an example actually of one of our Spanish advertisements. So when you call this line, you're connected with a trained Intermountain caregiver who provides that empathetic, non-judgmental source of support. They understand the situation you're going through by asking you a series of short questions, and then they're able to connect you with self-care tools, peer supports, treatment options, crisis resources, and more. So this is not limited to people. This isn't like waiting for people who are in crisis, who are suicidal. This is really meant to be especially geared toward people who are lower and medium risk, experiencing lower and medium levels of distress. And so far, since launching a few weeks ago, we've had over 750 calls. So, you know, I hope the numbers will, I don't hope the numbers will grow. I hate to think that there's those levels of distress, but I'm so grateful that it's serving as a resource to people who need it at no cost. If, on the next slide, you'll just to give you a sense of how it works briefly. Basically, we go through these validated screening questions, and then, as I said, we're able to group people into low, medium, or high risk, and then link them oftentimes right there on the phone with critical services, whether what they need is to just vent to someone who has skills in listening for half an hour, whether they need maybe an app which offers some really great mindfulness and sleep improvement modules, whether maybe they're more medium risk, they need to talk to someone. We can get them connected with their EAP, with former providers who they've worked with. We can connect them with scheduled video visits, really whatever they need. And then for the people who are higher risk, who may be experiencing more of a crisis, the state has amazing crisis resources, and we can hook them up immediately with that to de-escalate the situation and even deploy emergency response if needed. A couple other things to highlight on the next slide. You know, as we look to head back to business in whatever that new normal looks like, you know, I've included here kind of what the governor's office and others are framing as preparing our businesses. And this is not my area of expertise, but I would encourage you to continue. You know, the state of Utah has their phased health guidelines available. CDC is releasing nationwide guidance shortly. There's going to be a lot more coming out in the next few weeks. I think what I wanted to emphasize is that while all of these steps are really important to creating safety, we also need to be thinking about mental well-being as a core component of what allows us to return to work in a way that's secure and that's productive. So on the next slide, I highlighted a few of the things that the governor's office advises us to prepare our employees for, you know, hand washing, checking in with people who might have symptoms, staggering shifts, self-quarantine, accommodations. But I've added one at the bottom, which is really acknowledging the emotional stresses of this time and encouraging help seeking, making people realize that that's actually an act of great strength, an act of great preparedness. This is not a weakness to be expressing the reality of the stresses that we're all under. So on the next slide, I just listed a few of the things that you could actually recommend on that front relative to, mental well-being. And before I go through these, I think it's worth noting that even before COVID, I think there's been growing recognition, especially here in Utah, that mental well-being isn't just sort of the right thing to focus on as an employer, but that it actually has been shown to dramatically impact productivity and performance. It impacts our employees' health. It certainly impacts our quality of life and our sense of personal fulfillment. So even if COVID-19 wasn't with us, by focusing on mental well-being, you're actually creating a more productive and a higher performing workforce. And obviously all of us tend to spend most of our waking hours at work. So if we're not focusing on it, then who is? So I just want to make that case that this isn't just a sort of disaster moment we're in. It's really how do we begin to value this focus as in kind of normal times. Okay, so what are some of the things in the coming weeks and months that you could actually practically do? The first, as I hope I've been emphasizing, is to normalize the emotional and psychological challenges. Let your employees know this is a hard time. Maybe share the fact that you found it personally hard to get a good night's sleep or to manage your kids, or just humanize the fact that this is something we're all dealing with and that people aren't alone. So often people who are struggling the most are under a very false impression that they are the only ones feeling this way. It's irrational in a way, but it's kind of what their brain is tuned into. So reminding them they are not alone and that this is normal response to a highly stressful time. Another simple thing you could do is to promote a free 10-minute mental well-being training that we're just launching. I've included the URL there, and as I said, we'll circulate the slides after if you'd like them. It's a 10-minute training on how to begin that conversation with a colleague, with a family member, with someone on your team about their mental well-being with the specific eye towards suicide prevention. In addition, I mentioned the partnership with the Utah Shooting Sports Council. Intermountain Healthcare is actually making gun locks available for free to organizations, businesses, healthcare systems who want them. And so if you fill out a form on that website, we can send you a box of gun locks, as well as brochures that we've co-branded with the Utah Shooting Sports Council. If you're interested in longer term training, Intermountain can offer that for free also. We do 1-hour trainings that we've adapted into virtual settings. So just let me know, or you can email Christy Jones, my colleague, whose email is listed here. Obviously, please keep promoting the Emotional Health Relief Hotline. And if you need any of the visuals and flyers for that, just send me an email. And we have a lot of blog articles that we've been putting up on this intermountainhealthcare.org/COVID self-care, things around sleep, even things like intimate partner violence. We know domestic violence is really high right now. So making sure that your teams and organizations know where to turn if they're concerned about their safety, heaven forbid, in their own homes. And then obviously, if you have employee assistance programs, now's a great time to remind people about it. I'm constantly amazed how many of my colleagues don't know what EAP is, or the fact that it's a free benefit for themselves and their family members to get free counseling. We'll go on to the next slide. And just a few last things I want to leave you with. These were some slides that a psychiatrist friend of mine and I put together that might be helpful to you and to your organizations around just some, when you talk to lots of experts, what are therapists telling their patients? What is some of the most evidence-based practical steps we can be keeping in mind? And here are a few. Just remembering that exercise and physical activity are pretty magical when it comes to improving our moods and making us feel better able to handle stresses. So really encouraging your teams, your families to just get out on a short walk every few hours. This doesn't have to be like training for a marathon. Just getting the blood flowing can go a long way. Using technology to connect with family and friends. I've been really on the lookout for members of my team who live alone or who might be going through a divorce, people who might need that extra level of connection, because we don't want them to self-isolate right now. Looking for positive family time. My husband decided at 10 o'clock last night that he wanted to learn how to make bread. And so that is what he did. And it smelled wonderful, even though it kept us up a little bit late. So looking for whatever it is, whether it's baking, whether it's painting, positive activities that can kind of counter that negativity. Meditation and relaxation. Obviously, there's lots of great apps for that right now. Being discerning about your exposure to news. There's no question, if you're plugged into news all day, as I sometimes find myself just scrolling, it's just going to keep that stress feeling going. So try to limit it if you can. Clear routines and schedules, even on the weekends. I think there have been great examples of kids getting involved in making the family schedule and putting it on the fridge. It really creates that sense of control that we sometimes lack in our lives right now. Getting engaged intellectually, picking up a magazine or book, maybe instead of just looking on your usual Facebook or web pages. Finding activities you love and try to adapt them, even if you can't do them in quite the same way. Finding some alone time. I know it's really hard to do with families, but if you can even just find 10 minutes a day to just be on your own, that will really help you sleep better and feel more whole. And then a sort of silly thing, but like bathing daily. It can be very hard, especially for those of us working from home, to just kind of pull ourselves together. Try to maintain those routines that make you feel like a normal human. And then on the next slide, just some kind of high level thoughts. I won't go through these all in depth, but just remember for yourself and to remind others that things will get better. They will get back to normal. The world is not collapsing. I've really had to remind some of my colleagues about this, that using catastrophic language to say the world's coming to an end, it doesn't really help anyone. It doesn't help yourself. Try to really see if you can frame things in a more hopeful manner. It'll really improve the vibe of your office and your team just by kind of reminding people that this is really hard, but this is not the world coming to an end. Just reminding people that people are good. I mean, there have been so many incredible examples of service and of people helping one another. It's a nice reframe from kind of the negativity that we sometimes feel around us. Reminding people that you've overcome challenges before. This is a new one. It's kind of a bigger one, but each of us has faced personal trials, and we need to think about the fact that we've overcome those things. We've managed those things just as we are managing okay right now. Having a little bit of a sense of humor, I think, is really important. This is a strange time, and humor helps break down the intensity of it in small doses. The next one just talks about, the fact that it's normal to kind of feel some obsessive or compulsive thoughts. Just wash your hands, remind yourself that anxiety is normal, your brain is playing some tricks on you, but then try to move that internal discussion on. Moving down the list, let yourself experience a lot of different emotions. I think so often we think that we have to be in like today I'm angry, or today I'm sad, or today I'm stressed. But the truth is, all of us are capable of holding a lot of emotions simultaneously. So you can be really anxious about the economy and also really overjoyed to go for a walk with your neighbor, or your child. I mean, see if you can open up the possibility of feeling multiple emotional states simultaneously, not limiting yourself to one being fixed. And then finally, reminding people that while many of us are in positions of long-term planning, try as much as you can to not be worrying as much about the weeks and months ahead. If you can, try to take days where you focus on today and a little bit less about the days ahead. And then lastly, just wanted to leave you with, on the last slide, just the URLs that I mentioned that have the access to the self-care documents I mentioned, as well as our Zero Suicide website, which has the gun locks and that short course, the 10-minute module. And also my contact information if there's anything that I can do to help you or your organizations. And I will stop there and invite any questions. And Josh, I'm not sure of the format of how you want to do the Q&A, if people should just take themselves off mute or what you advise.
Yeah, I mean, people are welcome to take themselves off mute if they would like, or they can type a comment in the chat section. So either way, I did want to kind of focus on the uncertainty. How do you recommend, or what are some things that people can do to just keep some normalcy during this uncertainty? Because right now, businesses are juggling, okay, do we bring employees back? Do we bring them back in shifts? So it's going to be destabilizing. Everyone's got used to a certain way now for the last month and a half, and now it's all going to change again. And so what are some things that people can do to help stay sane?
Yeah, it's really hard. I mean, I think so often we're used to exuding confidence, whether it's with our kids or it's with our employees, that like, here's the message and I'm going to stick to it to give you all a sense of security. And I don't think right now that we have that ability. I actually, I think the most important thing is to let people know you are doing everything you can with the information you have, and that this is a universally uncertain time and that things may have to change. So letting them kind of almost feel what it's like to be in your shoes. It's maybe a more vulnerable tone than you're used to, but it conveys a level of honesty and authenticity that people will respond well to. So I think so it's not an easy answer. There's nothing we can snap our fingers and say, here's the certainty. But, I think if you can at least acknowledge to people that you're doing the best you can with their interests in mind, and that given the fact that the whole world is facing and our whole economy is facing uncertainty, that things may change, I think will make them empathize with the unique situation you're in as a leader. And in terms of just our day-to-day lives, I mean, as you can see, a lot of the tips that I mentioned before are about creating little bits of routine and control where you can have it healthily, creating a schedule, and that could be reflected in your workplace, by setting up regular check-ins, even if it's over Zoom. Like, let's check in every 10 minutes, 3 times a week, just to see how people are doing. You create kind of structure that makes people feel calmer just because they know they can anticipate. Maybe they can't anticipate where the economy is going, but they can anticipate a meeting on Wednesday at 3. And you'd be surprised how much of that actually reassures our brain and our neurological systems, just to have that sense of even minimal control.
So we were talking a little bit before about how we are reacting differently now to people. We're out in public and suddenly, oh, don't come near me, don't touch me. How do we try to normalize life, still be human to each other, and maintain that social distancing?
Yeah, it's really hard. And I think we're getting, talk about empathizing with our government that's trying to give guidelines, but they're very confusing, even, for any of us to interpret, do I need a mask always? Like, what about when I just go for a short walk? I think one of the things I've observed, and this is a bit of a shout out to Utah compared to the East Coast where I moved from, but people here really do give each other the benefit of the doubt. And they really, I've noticed culturally that there's really people want to assume the best in others. So when you see a child having a temper tantrum in a grocery store, you don't see people sort of making faces like they're annoyed. They want to help. And so I think lean into that as much as you can in trying, if you sense negativity in your own reactions to people, just remembering that all of us are facing carrying incredible burdens of responsibility and offering support instead of criticism. I worry sometimes when I see some of these like tattling features coming up, where you can tell on your neighbors. I mean, I get why it exists, and I think there are people who might be taking advantage of the situation or not being responsible, but I think reorienting our families and our organizations toward how do we help one another rather than pointing fingers is kind of important, just for making us it makes you feel better to just see the best and assume the best in others, as opposed to looking for flaws. So not an easy answer, but I would say it's more about the culture we set in our families and organizations.
So everybody has had to change their lives. Everyone. People are working from home. Kids are doing school from home. People have had to give up their social lives, a lot of things that they love. What are some signs, as we're going back to business too, or in our families, we can look for that maybe people aren't coping very well? They're not telling us, but they're not handling those stresses as well as they want us to think that they are.
That's a great question. Yeah, I mean, I think some of, every person's different. So I wish there was a single answer, but the truth is all of us manifest kind of complex stress in different ways. For some of us, it's going to be becoming more withdrawn, not wanting to be around people, not wanting to get out of bed kind of feeling. For others of us, it's like almost a more manic response of, I want to talk to everyone. I want to post on Facebook every 10 minutes. I want to just like shout from the rooftops about how hard life is right now. So there's no question that it's different for everyone, but what you want to be on the lookout for is what are changes in typical behavior. For people who who have weathered big or small stresses, what seems to be making this different for them? I had a neighbor, or I had a friend who mentioned that for her, it was when her neighbor stopped taking the garbage out. He was always out there Sunday at 4 p.m. taking the garbage, and she just noticed like 2 weeks went by. And so it turned out he was really dealing with some serious depression. But what an interest, but for that type of individual, that was kind of a flag. The obvious things that we look for, when it comes to really heightened risk, like someone might be heading more into a serious downward spiral that requires medical attention, is obviously if they're using substances or using them at a much higher level than you expect. If they're talking about wanting to hurt themselves, if they're or not wanting to be around anymore, if they're describing being a burden to others. I mean, those are times where really you might want to engage more professional conversation about someone. But I think it's looking out for those changes in behavior, which can range, as I said, from people becoming more withdrawn to people becoming quite animated in their reactions to situations. And remember that even though people may be not seeming like they want to talk about it, no one will, even if they roll their eyes, if you say, Christina, I'm worried about you. You seem really different than usual. And I really care about you and want to help. Like, even if you were to roll your eyes and I said that, deep down inside, you actually really appreciate that I've shown that empathy. And so I think that's what we all have to be courageous about is reaching out to people and saying that and letting them know you care. And even if they seem annoyed, you could actually really be stepping in and saving a life.
Oh, Josh, you're muted. We can't hear you.
Sorry, my kids were going a little berserk in the background. So on the chat, we have from Eliza, I understand why we should focus on the present as much as possible, but how can we figure out how to think about the future and about our long-term plans that used to be predicated on a pandemic-free world?
Oh, that is a phenomenal question. I so wish I had an answer to. I mean, I think for all of us, it's sort of figuring out a balance, right? I mean, all of you are here today and engaged in this work because you're leaders. You're responsible for people. You are responsible for businesses. So none of us has the luxury of truly focusing only on the present. But I think it's taking it in the right doses. So, recognizing what's in your control right now and what is not in your control, for which stressing and trying to control the situation is not going to be fruitful. So I think for each of us, it's sort of what is the right, and you could even write this out or journal. There's lots of ways to do this, but kind of figuring out what is it that this week is something that's within your locus of change. Maybe it's for right now, for some of us, it's just keeping the kids from killing themselves. I mean, like literally keeping blood from spilling on the living room floor. Like no joke, like there are people, especially families, where just getting through the day in one piece may be as far ahead as they can look. But there may be some of us who have supports, who have spouses who can be caring, who have other sources of support, where we can start to begin taking that out a little further to say, okay, for our family or for our company, what we can start to think about is getting to the end of this quarter, or kind of reassuring people that for the next 2 weeks, we've got them to this point. So I think for each of us, we just have to calibrate depending on kind of what our abilities allow us to do and where our companies are. But recognize that you're not alone if you're just feeling overwhelmed. And I think the key is to avoid the spinning within that sense of overwhelm, where you're just not sleeping, not eating, and the truth is none of that is really helping you or your organization to advance. So just try to calibrate and realize that even if you feel like you're way behind, we're all adapting in a way. We're all having to slow down just as we speed up in our preparedness. So it's a key existential question. So maybe others also have input on how you're thinking through that long-term planning as you deal with the short-term survival challenges.
Eliza said, thank you for that answer. We have another question from Selena. She said, it's wonderful information. I would love the slides if you don't mind. So we can make those available, Selena. If you want to put your email in the chat room, then I can send that to you specifically. She's asking, the 1 hour virtual training you mentioned with Christy Jones, is there a cost for that?
Yeah, no, it's totally free, and we provide the materials also. Although I should find out how we're doing. I actually don't know. It's usually a physical booklet. So the training that we do is called QPR, which stands for Question, Persuade, Refer. It's a training that introduces you in how to have a conversation, that kind of like the example I just did with Christina, like it's not always comfortable to ask people how they're doing mentally. Like even for those of us who work in this field, it can feel a little uncomfortable. So it's about practicing what to say and what not to say, and really understanding how you can not only bring up the conversation, but then actually refer people to resources. So it's a great training. It's like I said, we have this 10-minute version, which is a little intro, which never hurts. And then we have this hour-long version, which is a little more involved, but totally free. So feel free to email Christy or myself if you'd like more information.
So from Jeff Chance, he's saying, are you working on any specific telehealth initiatives driven by the present circumstances?
Yeah, a ton of telehealth work. Great question. I think this is another one of those things where when I'm feeling really sad about how much people are struggling, what really gives me optimism is that I think our mental health system in America and in Utah has basically achieved in 2 months what for 10 years we've been trying to do. I'm speaking a little bit in hyperbole, but what I mean is we had been trying for months and years to get telehealth capacity rolled out statewide, where you don't have to go park your car in front of the therapist's office, but instead can do this from the comfort of your home. And what has been basically developed by most mental health professionals in the state in a matter of weeks is tremendous. And a lot of that's been because the government has also loosened some of the very stringent requirements about what they can bill for. So yeah, we have a ton of work going on over telehealth. And what's nice is that emotional health relief hotline, we now can connect people. So here in Utah, a lot of mental health is delivered through counties, through local mental health authorities, and all of them have now come online in this sort of groundbreaking, fast-paced way to telehealth. And so if somebody calls our hotline, we can connect them for an appointment through a variety of providers, including those county-based therapists. So in a very strange way, this is almost one of the best moments to be trying to access mental health than maybe Utah's ever seen before. And it's all happened in the last 2 months. So that gives me a lot of hope.
So one of the issues I have been seeing, unfortunately, too much, when you mentioned the slide, trying to not be on social media too much or whatever, but as things continue on, there's a lot of people that get into the woods on crazy theories of why COVID is out there, and then they post them on social media, and all of a sudden everybody else attacks them, and so it becomes an actual place of disdain, discord. It's very difficult for people to interact nicely with each other. And I'm wondering, are there resources out there to help people understand, hey, this is how you should interact? I mean,
I know.
you'd think people would just understand and know that, but
it's really hard. I mean, this is one person's opinions, so some of you may bring others. My attitude about it is that social media rarely convinces people who have a certain viewpoint of another. I mean, it might expose some of us to new perspectives on things, but for the most part, it tends to be a sort of preach to the choir and agitate everyone else medium. And it's kind of part of what makes the algorithms addictive, because obviously all of these social media platforms want us on there all the time, is the way in which it raises our ire, our blood pressure when we see these. So my approach would be, if you find it entertaining and engaging and kind of a nice way to connect with certain people, go on a little bit. But for me, I've taken, I still have accounts, but I've taken the apps off so that I have to go through Internet Explorer just to make it a little less desirable, to kind of cut down that addictive behavior. There's also some really good apps you can get that limit the amount of time. So I limit myself to 10 minutes a day on Facebook. And so it will ping me when I've reached, you have 5 minutes left. And when you reach 10 minutes, it basically says, you can overpower it. But I actually think these tools, we all use them, or I shouldn't say we all, I use them. I think many people use them. And I don't think that I don't think it's the healthiest behavior to be on them as much as some of us are, especially right now. So I have been having to come up with some ways to just manage it. And that's what I would advise, rather than try to convince people, appreciate the entertainment value, roll your eyes, and then watch some good Netflix instead.
So Kelly asks, I have read that there is a positive correlation between high elevation and depression. Is that true? And if so, is that being magnified by the isolation and economic/social stresses of today?
Yeah, the work on elevation is really interesting in mental health. The data and research that I've seen, I think, makes a powerful case that specifically that how we metabolize antidepressants, SSRIs, which are basically drugs that are taken to help people manage the biological imbalances that can contribute to depression and anxiety. Some of the way we metabolize it does seem to be affected by altitude. Some people have taken that to build theories that that's why we have a high suicide rate in the Mountain West. And I will say, as a researcher, I find that data much less compelling. The basic question is, if it's not like our altitude has changed in the past 100 years, so that doesn't really effectively explain why we're seeing such increases in anxiety and depression and suicide. I'm much more persuaded by looking at a lot of the research, particularly that looks at the fact that while firearms are part of a lot of our family's culture, Utah's rates of suicide by things other than firearm actually aren't that much higher than the rest of the country. So what seems to be setting us apart a little bit is that there are a lot of people, especially middle-aged and older white men, who are having a life crisis and then are having really easy access to a lethal method of suicide. I mean, it's just what the data seems to show. It's not an opinion about gun ownership at all. It's just, and that's why actually the Utah Shooting Sports Council has been so engaged with us. But anyway, I think the altitude work is really compelling and interesting. So there's a lot of also interesting theories around air quality and depression and anxiety, but I wouldn't hang my hat on any of them as being kind of a major indicator of any kind of future state for us mentally and emotionally. I will say the Mountain West tends to be a healthier population. We tend to be a younger population, and that bodes really well for us when it comes to pandemics, because even if you yourself are in a high-risk group, the fact that Utah as a whole is a very young population means that hopefully our healthcare system isn't as overwhelmed if you or your older relatives actually need help. So that has us in a much stronger position than much of the rest of the country.
Good. Well, I don't see any other questions coming in. Does anybody else have any question they would like to ask? Now's the time. I will say there was a couple of things you mentioned in the slideshow, especially finding some good, wholesome activities. John Krasinski, who's famous actor, whatever, he started a YouTube channel called Some Good News. And so it's focused all on good, happy news and happiness. And so my daughter actually started watching that with me. He actually hosted a virtual graduation party for all seniors. But there are lots of things out there where people can find some enjoyable things. And the other note that I have, and we actually had Scott just mention it as well, for our mental health. So we should be seeing the Hill Air Force Base, their F-35As, they'll be flying over. So I live in Orem, so they're predicting about 1:15, Utah County between 1 and 1:15. So my whole family's going outside to watch these planes fly over. So that'll be a fun thing. There's a map out there for a lot of people, but just different activities for people to go do. Like you mentioned, there are a lot of things to help get our minds off of what has become kind of a crazy world. But do you have any closing thoughts for us, Morissa?
No, Kelly has another question.
Oh, okay.
I think anybody who knows Kelly knows this about him. He is very much an extrovert, loves social interaction. So how does he's asking, how do you find a balance between needing to get that social interaction? I'm kind of the opposite. Having a great time at home with just my family. We've been doing lots of fun things. I could probably stay here forever, totally fine. But how do people who need some of that social interaction, to stay mentally healthy, how do they find that in positive ways without overdoing the social media?
Yeah, it's a great question. I too have discovered during this pandemic that I'm much more of an introvert than I realized. And so it makes me, we were talking about this actually with Josh and Kelly earlier. I think, from what I hear from people who are more extroverted, like Zoom and these platforms are helpful, but they're just not quite the same. And I think that's understandable. I will say some of the extroverted folks on my team have especially enjoyed like games that you can play on Zoom, and you can Google this, but like not just having a conversation with people, but actually like engaging more interactively with some of the different games that are out there. So that's just one thing that I think kind of is enlivening. Another thing, especially as that we have as a privilege here in Utah that more dense places don't have, is just trying to get outside. I've done and I think this is responsible from what the governor would support, but full disclosure, maybe it's not. I've been doing some like socially distanced picnics with groups of friends where, one or two other couples or a couple families will kind of really spread ourselves out in a park. And oh my gosh, that was like game changing, because suddenly I got to actually like see humans, but still, we had our masks and we brought our own food. So two little examples, but again, I think social media does become an outlet of appeal. It has its place, but just remember to be in touch with yourself so that when it starts aggravating you, that you remember to switch to a different activity, because so often we kind of betray ourselves by just continuing to push forward and get angrier or get more wrapped up in a sense of comparison to other people. And it's just, they've designed that to hook you. I mean, that's why they've done it. So good luck, and let me know if you have other tips on meeting extroverts, need for more social interaction right now. But just in closing, thank you so much, Josh and team. I mean, it's such a just privilege to get to talk with people who are as thoughtful as yourselves, who are trying to kind of get all of us back to some normal. But also, I hope that the conversation has reminded you that it's really, really normal to be feeling not totally normal right now. It's a time when 100% of us, no matter what organization, what income, what neighborhood we live in, are really stressed. And I think the thing we can all go out and do, if nothing else, is just normalize it. Let people know that they're not alone. Let people know that we're going to get through this together, and have a little bit of a sense of humor about what can oftentimes feel, rightfully so, as a very heavy time. So we'll make the slides available, and more than happy to follow up. You've got my email if you have other things you want to discuss.
Yes, absolutely. Appreciate your time today. We will be making this entire presentation available on our YouTube channel as well, so people will be able to go back and review or share it. And then several people sent me their emails, so I'll make sure that we get that slideshow over to them. So Christina, any final thoughts before we wrap up?
Nope, I think that was really good. I got very absorbed in what you were saying. I think it was really helpful. I think, we're all just trying to deal with a lot of change right now. And so I think that is a lot of good information on how we can deal with that the best way that we can. Thank you for coming on.
Yeah, thank you, Christina. And thank you all. I really wish you the best, and hope that you're able to find some sense of stability for yourselves and your families and your organizations right now, even though it's really hard.
All right. Well, thank you very much one more time, and appreciate everyone being on the call today, and wish everyone a happy rest of the day, and enjoy the Air Force as they're flying over.
Sure.
Thanks, everybody.
Thanks.